Hi everyone! In today's clip, I will talk a little bit about tendonitis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, tendons are thick cords found throughout the body that attach bones to muscles. Tendonitis happens when a tendon becomes irritated and inflamed. Repetitive motions like painting or pitching are the main cause of tendonitis. Sudden injuries or degenerative conditions like arthritis can also cause tendonitis. Now, this can happen in any area of the body where there are tendons, but the most common areas are Achilles tendons, base of thumbs, elbows, hips, knees, shoulders, wrists, ankles. The symptom happens at the site of the inflamed tendon, and the symptoms are things like pain or achiness, tenderness, swelling and warmth, and redness. Now, and the symptoms can be acute when they happen suddenly or because of an injury, or they can be chronic when they develop over time or recur from a previous injury. Chronic tendonitis is more common than acute tendonitis. Each type of tendonitis has a medical name, and some of the names that impact the arms and hands are like, let's say, shoulder impingement, which affects the tendons of the shoulder. This form of tendonitis is also called swimmer's shoulder. It happens when the muscles and the tendons that lift the arm are injured or strained. Impingement syndrome is common to athletes who play sports that require a lot of throwing, overhead activity, and swimming. When you raise your arm to shoulder height, the space between the shoulder blade bone and tendons narrows. The bone then can rub against or impinge on the tendons, which causes pain. Although sudden injury can also cause impingement syndrome, it usually results from repetitive movements over time, like a swimmer repeating the same stroke. The good news is that most people are able to heal from swimmer's shoulders in a matter of months. There can be a variety of reasons for this issue, such as rotator cuff injury, shoulder instability, bone spurs, a tear in the cartilage, issues with tendons, or even osteoarthritis. Next is bicep tendonitis, which affects tendons in the upper arm. Then we have elbow tendonitis, when it affects the outside lower arm, the outside of the lower arm and elbows. It's called lateral epicondylitis or tennis elbow. Basically, this mostly happens when there's too much activity and there's not enough rest, which can weaken the tendons. When it affects the inside of the lower arm and elbows, it is called medial epicondylitis, or golfer's elbow, or pitcher's elbow. And this is when the tendons that connect to the forearm muscles to the bone rub on the inside of the elbow, causing elbow pain. Then we have extensor tendonitis, which affects the tendons that allow fingers to extend. We have thumb tendonitis, which causes thumb joint pain in tendons around the base of the thumb and the inside of the wrist and forearm. Then we have the type of tendonitis that affect the lower legs, and they are peroneal tendonitis, which affects peroneal tendons on the outside of the lower leg. We have patellar tendonitis, which affects the patellar tendons of the knees and causes knee pain. We have posterior tibial tendonitis, which affects posterior tibial tendons on the inside of the lower leg. And we have Achilles tendonitis, which affects the Achilles tendons found in the backs of the lower legs and ankles. And this form of tendonitis can cause ankle pain. So to see if you have tendonitis, the doctor will perform a diagnostic exam, which can include discussion of the possible tendonitis symptoms and the medical history, a physical exam to look for common signs of tendonitis like a thickened tendon or limited joint movement, x-rays if required to rule out other causes of pain. The first non-surgical recommendation to provide relief and restore functions can include rest, avoiding to use the tendon that hurts, or immobilizing the tendon with a splint, sling, or crutches. Medications, non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen, which can relieve tendonitis inflammation and help the person feel better a little bit. Physical therapy to strengthen tendons and reduce inflammation. Corticosteroid injections to reduce pain, but these injections should really be only for a very short-term use. Acupuncture to restore body's natural flow of energy or key energy and promote healing. Then there is something called platelet-rich plasma or PRP. So the platelets are a part of the blood that have proteins called growth factors and promote healing. This kind of a specialized tendonitis treatment, they're going to take some of your blood and separate the platelets. Then they combine the separated platelets with another sample of your blood so that it has higher levels of platelets and growth factors than normal. And then they can inject that blood back to the inflamed tendon where the growth factors can help and heal the injury faster. Now, if you have chronic long-term pain and these methods don't work or work only temporarily, your doctor may actually recommend orthopedic arthroscopic surgery, which is using small incisions. These procedures so that allow them to access and repair the tendon in a targeted way, leading to a less tissue damage and an easier and quicker recovery. Vitamins and minerals that can help heal tendonitis are collagen, vitamin C, as it helps build collagen and protect against oxidative stress, vitamins D3 and K2 in an MK7 form, as it supports proper calcium absorption and reduces inflammation, omega-3 fatty acids, curcumin, which is a potent anti-inflammatory, bromelain, which is an enzyme found in pineapple to help reduce pain and swelling, glucosamine, chondroitin, and MSM combination to help improve joint function and tendon recovery, zinc, and vitamin A. Now, of course, if you're taking these on a regular basis as a preventive measure, you would need much lower doses, but for healing, you will require much higher doses than usually recommended. Also, the dosages will change for each individual based on many different factors, of course. There are also several cannabinoids or compounds, with CBD being the second most prevalent active ingredient. Due to its popularity, CBD is one of the most studied compounds and has been found to have healing properties that the wellness industry actually promotes. CBD has anti-inflammatory and pain-relieving effects, specifically in sports recovery and musculoskeletal conditions like tendonitis and arthritis. This is a natural compound that works within the complex cell signaling system to provide pain relief and act as an anti-inflammatory. This is crucial in the treatment of tendonitis, where pain and inflammation are most prevalent symptoms. From the metaphysical point of view, holding on to anger and frustration can manifest as tension in the body, contributing to tendon inflammation. Other emotional factors involved are emotional blockages, which, as I mentioned, include repressed anger, resentment, or holding on to past hurts. The tendons are associated with flexibility and movement, so emotional inflexibility can translate to physical limitations. This ailment can also be translated as a resistance to change or reluctance to move forward in life. The repetitive nature of tendonitis causing activities may reflect a pattern of repetitive thinking or behavior that is causing emotional stagnation. Metaphysical beliefs sometimes also link tendons to the body's grounding or connection to earth. If a person is feeling disconnected or ungrounded, this could manifest as physical issues in the tendons. Also, imbalances in energy flow within the body can contribute to physical ailments. Tendonitis might be seen as an energetic blockage or disruption in the meridians associated with the affected area. Hope this has been helpful. Like and follow for more. Be the light.